Today, we will review another commonly overlooked entity. The initial clinical impression in these cases is often an endocervical or endometrial polyp. On low power, we see a polypoid lesion composed of irregular glands embedded in a dense stroma. Notably, the stroma immediately surrounding the glands is darker and more cellular than the background stroma. This is high-power view of the glands and stroma. The gland is lined by a single layer of benign ciliated epithelium. The stroma is hypercellular, more condensed immediately surrounding the glands than the rest of the stroma. We call these periglandular cuffing. On high power, the glands are lined by a single layer of benign, ciliated epithelium. The stromal cells show a high nuclear to cytoplasmic ratio, but only mild cytologic atypia. Occasional mitotic figures are identified. In other areas, we again see benign glandular epithelium surrounded by hypercellular stroma with mild atypia, along with additional mitotic figures. In this picture, we again see benign gland and stroma with periglandular cuffing. Architecturally, the glands are often dilated and rigid, lacking the undulating contours seen in benign polyps. In some areas, a phyllodes-like growth pattern is present, with intraluminal papillary projections. In summary, the key morphologic features include a polypoid lesion with a biphasic composition, benign glandular epithelium, and hypercellular, mitotically active stroma. There are characteristic architectural abnormality including periglandular stromal condensation, cuffing, phyllodes-like architecture, rigid cystic glands, and intraluminal papillary proliferation. These findings support a diagnosis of adenosarcoma. Adenosarcoma is an easy-to-miss entity. In some cases, periglandular cuffing is subtle and may be overlooked if one is not specifically looking for it. Additionally, stromal mitotic activity can be minimal or even absent. Importantly, mitotic activity is not required to establish malignancy in this tumor. Many lesions previously diagnosed as endometrial or endocervical adenofibroma are now recognized as adenosarcoma. For example, lesions initially labeled as benign adenofibroma may show a polypoid architecture with phyllodes-like growth and subtle periglandular cuffing, features diagnostic of adenosarcoma. In the current WHO classification, adenofibroma has been eliminated as an entity in both the endometrium and endocervix. Clinically, adenosarcomas generally have a favorable prognosis when completely excised, and some patients may be managed conservatively without hysterectomy. However, incomplete excision can lead to recurrence, high-grade transformation, and even distant metastasis. Accurate diagnosis is therefore essential for appropriate patient management. Sarcomatous overgrowth is defined as a pure sarcomatous component, without glands, comprising more than 25% of the tumor. In most cases, the sarcomatous component is high-grade and is associated with a worse prognosis. The main differential diagnoses include benign endocervical or endometrial polyps and atypical uterine polyp. Benign endometrial polyps are also biphasic, with both glandular and stromal components being benign. The glands typically show irregular lumina rather than the rigid, dilated cysts seen in adenosarcoma. There is no periglandular stromal condensation, phyllodes-like architecture, or intraluminal papillary proliferation. Atypical uterine polyp is a recently described entity for lesions that show worrisome features but fall short of a definitive diagnosis of adenosarcoma. For example, some cases demonstrate only a single focus of phyllodes-like architecture with periglandular cuffing, insufficient for a diagnosis of adenosarcoma. Other cases show diffuse architectural complexity but only mild periglandular condensation. In these lesions, the atypical features are quantitatively or qualitatively insufficient for adenosarcoma. A study from Dr. Nucci's group evaluated 63 cases of atypical uterine polyp, published in Modern Pathology in 2022. These cases pose a significant diagnostic challenge due to their important therapeutic implications. The study demonstrated that atypical uterine polyps share multiple molecular alterations with low-grade adenosarcoma, suggesting that some may represent incipient adenosarcoma. Notably, all 63 cases followed a benign clinical course. As a result, conservative management with close clinical follow-up is recommended. In summary, adenosarcoma is a biphasic malignant neoplasm with benign glandular epithelium and malignant stroma. Key features include phyllodes-like architecture, rigid cysts, intraluminal papillary growth, and periglandular stromal cuffing. Morphologic features may be subtle. Atypical uterine polyp is reserved for cases with worrisome features that are quantitatively or qualitatively insufficient for a diagnosis of adenosarcoma.